What is good, people? John here from A Drink with Monty. Molly and I had the privilege of sitting down and talking with Dr. Brandon Grinage, an anesthesiologist, and Wesley Karcher, who is a CRNA, and they're the founders of the Invictus Clinic. The Invictus Clinic is a treatment center for people struggling with things like depression, anxiety, PTSD, and chronic pain. They use a maybe not so well known psychedelic drug called ketamine. We're really excited about this episode and hope you enjoy. Shouty. What's going on, guys? How are y'all?
Doing well. Had about 3 infusions to do this morning, so it's been a busy morning.
That's good.
Wow. Thanks
That's
for
good.
making time for us. We appreciate it.
Oh, absolutely. Absolutely.
This is something John and I are extremely interested in. We love
Good.
learning alternative forms of medicine and all of that.
Well, the first responder community is definitely the demographic we're trying to hit. So
Really?
whether it's veterans, first responders, and we've even extended our discount to frontline workers during the COVID crisis. So if you're somebody working in the ICU or somebody with COVID patients, then we'll give you the same sort of discount.
So we got connected from Val. Tell me how you guys know Val.
Yeah, so I work with Val at Altoona Dental on it's family dental practice up in Cartersville. I'm an anesthesiologist, so we started this clinic in February. I still try and keep my skills up a bit, so every now and then do a little OR anesthesia, and he's the nurse in the room with me sometimes up there. So sitting in a room and getting to talking, and started talking about this, that, and the other, and him talking about working through the fire department, and he asked if I knew you, and I was like, no, I don't know. So anyway, that's basically it, because I had talked to him about PTSD and really trying to get in with it, and I was like, firefighters and police, it's almost impossible to get in with you guys because of the concerns over being taken off the job if you get diagnosed with PTSD, which is absolutely asinine, but I get
a lot,
it.
man.
Yeah.
Well, good. I think that'll lead us into the first question. So just tell us about the Invictus Clinic and what you guys do exactly.
Sure. Invictus Clinic was, the name was from Brandon. He has a poetry minor from the past.
Tough guy.
So, yeah. He loves, and he writes good poetry as well. But you can tell him about Invictus, Brandon.
No, so Invictus just means unconquerable. So the way it started for me was Wesley calling me up and asking, what do you know about ketamine and depression? And said, I know they're studying ketamine for depression. We use ketamine a lot in the ORs. It's an anesthetic drug. And he's like, well, thinking about opening up a ketamine clinic for treating depression and wanted you to join me. So I kind of hesitantly said, I'll look at it. I assumed it was kind of one of these placebo equal type things where it might not work, and I wasn't going to try and take advantage of people that are down and out and desperate. So I said I'd look it up just as a solid to Wesley, just because we had worked together before, and I like him, and he's a good guy, and looked up some studies, and first study was 70 to 80% success rate in treatment resistant depression. I assumed that had to have been a one-off study, and kept on looking at the next study and the next study, and they were consistent. 70 to 80% success rate in treatment-resistant depression, PTSD, suicidal ideation. And he alluded to my poetry minor. I was actually a marketing major originally, and worked in business, worked in investments, had gone back to med school following the suicide of one of my friends. So that, coupled with 3 cousins and an uncle that have committed suicide. Wow. And so it just, that whole treat depression, it hit home with me. It just felt like a door opening that was too perfect for the reason that I came back to medical school. And that was to help people out and to make a difference to the extent that I could. So that's what Invictus is to me. It's just trying to, for the people that feel, God, I've tried everything. I've tried therapy. I've tried medicines. Nothing's working. that there's still hope, and it's phenomenal hope, and it's it's a wonderful thing.
From the overarching company perspective, Invictus Clinic we have sort of 3 arms to our clinic. The major one is ketamine, and we use ketamine for the treatment of treatment-resistant depression, PTSD, anxiety, suicidal ideation, bipolar, as well as a lot of chronic neuropathic pain. And then we're also branching into treating acute pain as sort of ketamine has a really good basis, has good analgesic properties. It sits in the same receptors as opioids, so it can give you good pain relief and hopefully decrease the amount of opioids people are using until they can get definitive treatment, such as surgery or something. But second arm is our IV nutrition, vitamin therapy, chemo support type stuff, B vitamins, magnesium, calcium, high dose vitamin C, normal doses of vitamin C. And then we've also started doing NAD, which stands for nicotinamide adenine dinucleotide. It's really come up about, it's more like anti-aging, general wellness, and then
I've heard of that.
Yeah, and sort of mid doses, it's good for neurodegenerative disorders like ALS, Alzheimer's. It can even be used for anxiety, depression, although I think ketamine works better for those indications. And then in higher dosages, we use it for getting people off of addiction, especially like cocaine, alcohol, things like that. It decreases your cravings for those substances.
Opiate.
Okay.
Opiates, yeah. Yep,
Now,
yep.
Wesley, where did you even get the idea? Like, how did you come to approach Brandon about this?
I am connected within, so I'm a certified registered nurse anesthetist. I'm a CRNA. So we kind of do the same job. Me and Brandon do. It's just he's an MD, I'm a CRNA, but I'm kind of connected within my national organization, and I'm about to be the president of my state organization here in Georgia. And so we get to go to a lot of conferences on the dime of the groups that we belong to.
On the job.
And there's been a lot of talk about ketamine and people breaching into that company. And it just seems like a perfect fit for somebody in anesthesia. Me and Brandon are very quick to tell people we're not mental health professionals. We are experts at anesthesia, and really ketamine is only FDA approved for the induction of anesthesia, which is going to sleep. So it seems like a perfect fit that if you're going to get ketamine, that an anesthesia professional should be the one to give it to you, working in concert with therapists and other things to make sure, you're getting proper diagnoses and helping people that are going through tough times. And although I don't have any suicide history in my family, I definitely have a deep mental health history in my family. So just like Brandon, started doing the research, and it was really hard to find stuff that said it didn't work. Everything was 70, 80%, and they're doing more and more research, and it's an old drug, but it started exploding around like 2015, 2016. And it's sort of gone up from there. And it seems like every month or two, there's some new research article coming out showing some new system that it works on. And it's really, who would have ever guessed psychedelics would be the next frontier in mental health treatment? But I mean, we've seen
saying it forever. Joe Rogan's been pushing psychedelics.
Yeah.
He also does NAD as well. Although
that's actually where I heard of NAD.
Yeah. He does it in a manner that we don't condone, but I think he gets his infusion in like 15 minutes and fingers burn. And, me and Brandon tested the NAD just so we could have a sense of...
I was going to have a hard time promoting anything that I did not believe in and didn't work.
So we gave ourselves NAD infusions, and they kind of talk about the symptoms you get while you're having NAD, and if you do too fast, it sort of feels like an elephant sitting on your chest. And I've never had a panic attack before, but they are definitely telling the truth that you do too fast, and it's like your breath is gone. So I can't imagine getting that in 15 minutes and not just like feeling like you're suffocating. I mean, he says his fingertips burn and all kinds of stuff, but to me, it's like, why? But that being said, we have not tried ketamine ourselves. So yeah.
You're going with the studies on those. Okay.
Yeah.
So what is ketamine? You told us about how you guys got into it and why. What is ketamine? And break it down for kind of the layperson.
Sure.
So ketamine's an anesthetic medication that was FDA approved in 1970. It's a dissociative anesthetic, used a lot on the battlefields. We use it in pediatric anesthesia, obstetric anesthesia. So it's a very safe drug. It's on the WHO's list of necessary medications or essential medications.
It's also the number one used medicine in the military and the battlefield. Yeah.
Yeah. So that's what ketamine is. And for 50 years, they've used it in the ORs and on the battlefield, and it's been a safe medication. It's just in the last really 10 to 20 years kind of started to take on these new understandings and benefits of the medication for chronic pain and for mood disorders.
It just sort of just works in a different way. So as you said, it's dissociative, but what they found is it works on a lot of different systems. It's classified as an NMDA, an N-methyl D-aspartate antagonist, but most anesthetics, when we put somebody to sleep, they inhibit something or, to make you fall asleep. Whereas ketamine is an excitatory drug, and it gives you that sort of out-of-body experience. So when we put somebody to sleep with ketamine, their eyes can be wide open, but the consciousness basically isn't there. So they disassociate and they're not sensing what's happening. We don't give those kind of dosages in the ketamine clinic. They're what we call sub-anesthetic dosages. So people aren't going under like that. But it's a very interesting drug. But for the most part, the research shows from the mental health perspective, the ketamine is working on a lot of different systems, but the main one they think is the glutamate system. And that basically increases neurotransmitters within your synapse and creates an increase in a substance called BDNF. And that BDNF actually helps to grow new neurons and synapses. So you actually are growing new connections in your brain. And if you look at somebody's brain just as a control, just under normal circumstances, whatever they're going through that day, that sort of part of their brain will be lit up. Whereas if that person is under ketamine, there's all this cross reactivity between the hemispheres and the entire brain. It looks like this rainbow of color because left and right brain are just crisscrossing, and that's why people are dissociating.
Okay. So you guys said you started in February of this year, 2020?
Perfect timing, right?
Yeah. Wow. What a time to open a clinic.
Yeah.
Well, the unintended, bit of it was February 18th was our opening day, which was exactly 19 years to the day after the last time I had talked to my friend that committed suicide. Completely unintended, just happened to be that way. That's when we got our CO, but the day kind of struck me that morning. I was like, February 18th, interesting.
Wow.
I don't even think I knew that, so I'm learning something today.
That's amazing. It kind of seems like, everything was meant to be with all the coincidences that go around it. As far as opening the clinic, did you have to get any certain kind of certifications? What did you have to do, legally to open something like this?
That's a great question. I did a lot. I did a lot of searching. I mean, other than being a CRNA or getting your medical license and being trained to give ketamine, there really, other than the typical or sort of permits and city inspections, we didn't have to have any inspections before. I mean, it's like a typical medical office. They don't really have, unless you're opening a surgery center where you're going to be sterilizing equipment and doing invasive procedures. There's not really a whole lot. And I called the public health department, community health, whoever comes in and inspects restaurants, and everybody was like, no inspection necessary, which kind of shocked me. But hey, we're here.
Seriously,
I mean, we did our research and did everything proper. I actually I bought a sterile hood, to mix medications under, and it took 3 months to get here by boat, and
it was during the government lockdown, shutdown.
Yeah,
trying
luckily
to get.
It got through, but yeah, I mean, other than having the license to basically get the medicine, one, so you have to have a DEA license, and then two, having the certification to actually be able to handle giving the medication. There really wasn't a whole lot.
And that's one thing is, as anesthesia providers, we deal with ketamine on a daily basis. I've used ketamine since my residency days and starting in 2008. So we have lots of experience with ketamine, but I think that's a good point to make is there isn't a whole lot of certification and whatnot needed to open up and be able to give ketamine. So I think it's important that people know who's administering the ketamine and make sure it's somebody that has the experience and the credentials to deliver a safe ketamine infusion.
Mm-hmm.
Yeah.
Yeah, for sure. To definitely do your research and know who you're seeing when you seek treatment like that.
With us in the field, I work for the fire department, and we transport. And I don't know if you know our medical director, Jill Mabley.
I know the name.
She's very, very, very pro ketamine. And I think early on, a lot of the local hospitals were against it just because from what I was told, there was not much education. And, but she has been very, very pro ketamine, and we actually are looking at using it for seizure patients. We give it for pain management. It's actually pretty much our frontline pain management drug.
Mm-hmm.
And then we also give it for the dissociative effects, for patients or, whatever. But so we give our pain management dose in a 10 to 20 milligram. And then obviously the 500 milligrams for dissociative effects. I don't want to jump ahead, but just thinking of dosing, for you guys.
Yeah. Okay. What's the dosing like?
Yeah. So
much less.
So for mood disorders, it's usually we start around 0.5 milligram per kilogram. So let's assume a 100 kilogram, 220 pound patient, you're looking at 50 milligrams through an IV over 40 minutes. For pain infusions, and then we titrate up for the dissociation. So we may get up, higher than that. We may get up to 1 or a little bit more than 1 milligram per kilogram. And then for pain, you're looking at starting usually around 0.7 milligrams per kilogram and kind of going up from there. So it's far less than the 3 to 5 milligrams per kilogram that you're using out in the field.
Yeah. Pain patients will get a lot more medicine, but their infusions are done over 4 hours versus mental health, which is done over 40 minutes because we're trying to work on different systems. For pain, we're trying to saturate and calm down nerve pain signals versus mental health, where we're trying to have the neuronal and synapse growth to help medicines work better and help you make new connections in your brain.
Okay, that kind of just segues into one of our questions we had was how is this like a long-term effect? Like, does it only happen? Obviously, it improves brain function after the treatment. How does that actually work? What is it technically doing?
Yeah, so it's for the mood disorders. It's basically creating new synapses. One there's a TED talk out there on it that said it very well. If you look at a healthy brain under a microscope, the synapses look like a tree with leaves on it. In a depressed brain, it looks like a tree in the wintertime with no leaves. And the ketamine is basically creating those synapses and those connections that puts those leaves back on the tree. That allows the neurotransmitters a place to bind to create the response in the brain that gives you the pleasurable experiences. The way I like to say is, if you have a car and the engine's not running and you have gasoline in it, putting more gasoline in there is not going to make the car run. You need to work on the engine. So if you have a brain that, you have serotonin and you're giving it these medications like serotonin reuptake inhibitors, which may very well still be needed, but it's not necessarily working because the binding points for those neurotransmitters aren't functioning properly. And ketamine helps fix that, so that then the serotonin or whatever can then have a place to bind and function.
So you would encourage, if a patient comes to you and has a history of mental health issues and is taking your SSRIs or just any antidepressant, the use of ketamine can actually increase the effects of those drugs. It can make them work better.
Yes, absolutely.
That's the hope. And I mean, we always tell our patients that, obviously there's a certain percentage of patients, which honestly we haven't seen yet, but the research shows that there's 20 to 25% of patients won't really see a benefit from ketamine, but that's still at 75 to 80%, way higher than pills, which are at like what, 25-30% success rate.
So essentially, yeah, we tell our patients, look, you're going to keep taking your medicines.
Oh yeah, that's right.
And for the short time well-being, we're not taking people off their medications. We work closely with LPCs, counselors, psychologists, psychiatrists, to say, hey, look, we're going to help these medications work. As they're working, then the goal would be to maybe come off. Some patients come, they're on 3 or 4 medications. Maybe we can get them down to 1 medication. Ideally, yeah, you come off all those medications, but that's not something we're looking at doing in the first, month, 2 months, or sometimes even 6 months. Let's focus on making it where these medications are working for you at that point. And then if we can come down off of them, that's just kind of the cherry on top.
Yeah. That's kind of how we frame it. I mean, we hope over time for mental health, patients are going to come back for boosters after their initial series of 6 infusions. But we hope to get them to a point where they're spaced far enough apart to where at some point they don't feel like they need the ketamine anymore. And they've started to sort of pare down those mental health medications. But I mean, for pain, it's sort of a different animal. Typically those patients, the ketamine really helps, but they need to be put on a pretty regular schedule of coming back for, a 1 or 2 day booster, to keep up those, pain inhibitory effects. But I mean, we've had patients come in here on canes, and by the end of their 6th infusion, they're, walking trails in the woods, no cane, and no pain. And it's pretty amazing to see, but sort of a different approach for both of those.
How does it technically work for pain management as far as the depression goes? You said it's like putting the leaves back on the trees, but how does it help as far as pain?
Well, a lot of times with pain, they have co-occurring mental health disease. So the good thing is that since pain is done at a higher level, we still hit all the mental health stuff. So all that same stuff is happening. But the way I explain it to patients is with chronic pain, you have constant signals coming in from your periphery, coming to your central nervous system, your spine and your brain. So the wave kind of looks like, up and down, up and down, up and down. What ketamine does is essentially doesn't stop it, but it goes from this really fast wave to a really kind of slow, calm wave. So the research shows on average, a patient would go from like a pain score of 7 to a pain score of 3 after their infusion. So they're still feeling something, but it's drastically different.
How long would that last?
Every patient's different, and it depends on their diagnosis. A lot of our patients for pain are CRPS patients, complex regional pain syndrome. And that's a really, really tough disease. Most of them come back either on a monthly or bi-monthly basis for boosters. And they're pretty tuned into their bodies. They know this is normal, this isn't right, stuff's starting to wear off. And yeah, we just basically they check in or we check in at that point and get them scheduled. But typical after an infusion, after you had your initial series, you should be getting 4, 6, sometimes 8 weeks of relief from that pain before having to come back in for a booster.
Yeah.
To go from having to take, like you said, those narcotics every day to an infusion every 4 weeks, in a good case, I'm sure, right? I'm sure but may need more, but I mean, God, even to go once a week and not have to take that stuff, that would be so like the mental health side, are you coupling this ketamine with their narcotic pain medications, or do you wean them off, or do you say, hey, we're going to give you this, but you can't take this?
we usually keep them pretty even keel. We don't, we're not the ones trying to reduce their pain medicine. We always try to do that in concert. They usually all have pain medicine docs that, pain management practices that they're already a part of. So with the ketamine, if they're feeling good, that would be us working in concert with their pain management doc to say, hey, if you feel like it's necessary to wean their opioids, then that might be something to look into. But we sort of leave that to those experts.
Sure.
And then I guess that kind of goes hand in hand with treating addiction. They don't feel that they have to take whatever they're taking
Right.
because of the effects of the ketamine.
Yeah, the addiction side with ketamine treatments, treating addiction, that's been a real. It's fairly new. A lot of people still say ketamine's an addictive drug, and yes, with constant use, you become sort of dependent, I guess, upon it. The way we use it, you wouldn't, because there's long periods of time between when you're using it. But stuff for especially alcohol and cocaine and things like that. There's been great research coming out from the UK. I think Columbia University had a research article, and there's one that came out of Texas showing great results with treating alcoholism with just a single dose of ketamine. So, the one out of the UK, basically they would ask the patient's drink of choice, beer, wine, cocktails, whatever it is, and they would create pictures of those drinks. And before they gave them the infusion, they would show them, they'd have them go through these pictures and it sort of, I guess it brings up happy memories, and that triggers that portion of your brain. And then they would give them their ketamine infusion. Research showed that they reduced their alcohol consumption drastically for a period of 9 months after one infusion.
Wow.
Now with no pictures and just ketamine, it was like 3 months or 4 months. So somehow the pictures trigger something that then the ketamine slices off, and you just don't crave it anymore. Same with NAD. It reduces cravings, so that hopefully if we're treating them while they're in their withdrawal phase, they're not craving that substance. And usually withdrawal phase 10 to 14 days, and you're more likely to not go back to it if you can stay clean for that long. So hopefully if we can, NAD series for addiction is 10 days long, which fits right into the amount of time you'd be going through withdrawals. So.
Wow.
So let's back up. Let's say I'm a patient. What would the process be for me to become a patient of yours? From picking up the phone or Googling you guys, what would that process look like?
Yeah, it's pretty, we try to make it pretty easy. Patients have said it's fairly easy. For ketamine, you're going to need to call us. We have forms. You can fill out a form on our website, theinvictusclinic.com. And it'll send something to us, and we'll follow up with you. Or if you call our clinic directly, one of our receptionists will answer, and we'll basically go through your history. Most of our patients are already coupled up with a therapist of some kind, or pain management doc if it's for pain. As I said, me and Brandon are not mental health professionals. We don't feel it's within our wheelhouse to diagnose somebody with mental health conditions. So we like to have something within our medical records, either a copy of their medical records that shows they have a standing diagnosis for something we can treat, or we send them to somebody that can do a consultation with them to give us a proper diagnosis for what they have. So it would be either the patient signing a medical records release form, so we can get your medical records, or a referral from whether it's an LPC or a psychologist or a psychiatrist or a nurse practitioner, psychiatric nurse practitioner. Even your general practitioner can really do it. But and then once we get those, we basically set you up, put you on our schedule. For mental health, it's 6 infusions every other day for 2 weeks. And for pain, it's 6 days in a row of 4-hour infusions. So it's you're going to be out for that week if you're having pain infusions. But that's pretty much it. But we, for first responders, veterans, and frontline workers, we offer a 25% discount for our services. If you're not one of those, and you want to pay for everything up front, we give a 15% discount for if you pay for the whole series up front. You know, we try to make it easy. We realize, unfortunately, insurance it's not FDA approved. This is not you know, yeah. We're working hard to compile information to hopefully get FDA approval someday. I'm not extremely hopeful because ketamine is a generic drug, you know, and no company's going to make a profit off of it. They're not going to put millions of dollars into a large enough study for the FDA to say it works. There's plenty of research out there, but those studies don't have high enough numbers of patients for the FDA to say it's a big enough study. I mean, they want like 1,000 patients or something.
Right.
So until that happens, you know, we do super bills that we give to patients that they can use our system that we use called Reimbursify, that they can put in and out of network, and Reimbursify will kind of take care of everything. And hopefully they'll get some money back. They usually won't pay for the ketamine, but sometimes they'll pay for the infusion itself, whether that's the fluids or the IV start or what have you. And, you know, our typical mental health infusion is $400 an infusion. So the series of 6 is $2,400. Obviously with that 25% discount, it's $1,800. But, you know, if you can get $200 of your $400 back from your insurance company, it really reduces the cost for the series.
Yeah, that was one of my questions is, you know, why has the FDA not approved it? If it's got such great results, then, you know, why is this not more widespread? I feel like it's like coming on the scene recently. I mean, I remember when you guys got them. Yeah. I remember when they first got ketamine on the ambulances. It was only like 2 years ago?
No, we've had it for, our department's carried it for probably 5 years, but only the supervisors carried it, and you had to call them and get orders for it. But now, I mean, hell, we give it for really anything we want.
Right, but that was like recent.
Within the last 5 years.
Yeah. It's crazy that this wouldn't be more like everywhere.
I agree. I mean, I really do sometimes wish that we could film patients series. I mean, it would be a great film series, but me and Brandon, the stuff that we've experienced with our patients just since February, if I could tell you the number of times we've heard from a patient, this is life-changing. It's nuts. You know, I would have never guessed psychedelics would, you know, I didn't grow up as a kid, you know, doing drugs and stuff like that and experiencing these things. And it's definitely it wasn't my wheelhouse, but if there's good research out there on something, I'm willing to give it a go. And
sure,
that's what I tell patients all the time is, you know, me and Brandon saw the research, we saw that it was good, but until you actually see that it actually works, you're not fully bought in. And I can tell you, me and Brandon are fully bought in at this point. I mean, it's, you know, people coming in at mood scores of 0 and 1, consistently rating themselves in an 8 now. You know, we've had people go from 2s to 10s. And it's amazing. And it's good to see the commonalities between patients is also the differences. But I mean, almost all patients that have some sort of like suicidal ideation or anxiety and depression, I mean, one infusion typically of ketamine will knock out your desire for suicidal ideation. Most patients tell us that they don't even think about it anymore after one infusion. And then the next thing to go is patients the anxiety disappears. They'll go through an entire day and they'll get to the evening and they're kind of looking around and saying, I didn't experience any anxiety today. I was waiting for it, but it never happened. And I had a patient this morning. She, again, said life-changing. The way she described it was, I felt like I was living in the basement of my emotions. And now I feel like I'm sitting on the front porch drinking tea. Wow. That was her words. And she's like, you know, this crippling anxiety is gone. I had a patient yesterday tell me the same thing, that this crushing sort of feeling on your chest, it's gone. I can breathe again. And then after, you know, 4 or 5, sometimes it takes 6 infusions. Sometimes it takes to your first or second booster, that depression starts to fade. And usually family and friends notice it first. Patients don't see the subtle differences, but boy, if it's somebody like living with a parent or a spouse or something like that, they'll be the ones saying, I've noticed a difference. And we noticed it too, even though we've just met these people, we've only known them for a few weeks, whether it's they no longer have a flat affect, they're more animated, they're laughing, they're telling you jokes. We've got one patient that's now just took a trip to Europe, went there for 30 days to learn Russian. He's trying to date now and shaving, he's tan, he's wearing cologne, it's amazing.
And in March that was unthinkable. I mean, just
yeah, absolutely.
Where he was in March compared to where he is now, it's why I decided to do it. It's what I hope to accomplish opening a ketamine clinic, and it's what we achieve. I mean, it truly is. It's truly amazing.
Yeah.
Now, how did you guys? It's so new. How did you guys market yourselves and get patients? Did you reach out to therapists and pain management places?
We started to, and then COVID happened.
Yeah.
So we had made a few appointments. We went by and saw some therapists, counselors, and had some more of those on the books. We had a couple of big conferences scheduled to where we had, paid for the tables to go out and kind of talk to people and network that way. Of course, all those got canceled.
Mm-hmm.
So, a lot of phone calls and whatnot. And we made one very strong connection with an LPC who opened his own place up, July. And he was a big believer in ketamine. He had seen it work. He wanted ketamine to be a part of it. So we actually leased a space inside of his office. So we're doing that in his office as well.
Wow.
And he's sent us a couple of patients, and using his network, he's told a couple of counselors about us, and they've sent us patients. And I believe every patient or every counselor that sent us a patient, counselor or psychologist that sent us a patient, I believe, has referred us a second, has talked to us about a second at least. And, just because usually what we end up getting are their worst cases. I've tried everything. We've tried this drug. We've been doing this for years. We've got no progress. Maybe we should try this.
Yeah. Why not kind of thing.
Yeah. And then they see the difference that it makes in that patient. And they're like, okay, well, let's try this one, and the same thing. So it's kind of that network, and it's, COVID's kind of made us have this kind of a grassroots movement with it. But the other thing is we do have a media company that we've partnered with there's ketamine specific. So that, they do our website and our Facebook advertisement kind of stuff and Google and all that stuff.
We'll give them a plug. Their name is Ketamine Media.
Yeah.
But yeah, that's sort of they're out of Knoxville, but they're sort of a niche.
Well, your website looks great. Yeah. I loved your website.
Thank you. Yeah, that's been many hours of creating content and then revamping whatever, and we finally did those. If you look at the homepage now, there's 2 videos there of patient testimonial, and then me and Brandon doing sort of I don't know what you'd call it, an infomercial or whatever, but that finally got put on there a couple weeks ago, and that's been really helpful. A lot of times I think we can tell a patient as much as we want how it works, how it's going to work, how it's going to help them, but until they actually see a patient talking about how it helped them, that's sort of the trigger to say, okay, well, I'll give it a try.
Yeah. John's had experience. He's talked about it with ketamine, and he kind of was knowledgeable about the ketamine treatments and stuff. I had zero. I knew nothing about it. And your website was actually the first thing that I looked at, and
good.
It was super informative. I love the website. I'm like snotty when it comes to apps and websites and stuff.
Huge nerd she is.
Yeah.
Nerd.
I like the color tones, but I don't like really busy websites. Sometimes you get to those, I don't know what you call them, ghost websites or something. You get drawn into a link or something. It's just sort of just this busyness,
Flashing stuff everywhere.
Yeah. Like we've got a number of pages that you can go to on our website, but they're, it's very broken down. And if you're looking for this, go to this page. So you're not having to look through the entire website to find what you need.
Mm-hmm. Yeah, definitely.
But yeah, that's good to hear. Good to hear. Money well spent then.
Yeah, no, I would say it was worth it. So coming from the first responder perspective, one of you guys mentioned the stigma with mental health, right?
Mm-hmm.
And I will say within the last 2 years, there's still a stigma, but it is talked about a lot more and it's more accepted. When I first got hired 10 years ago, you didn't talk about it. You know, when I got hired and went through recruit school, there was no mention. Nobody even informally came to us and said, "Hey, you guys are going to see some bad shit. Just heads up, talk about it." It wasn't even like that. And I would say it's really hit big in the last 2 years. But, you know, you guys know with first responders, we can't do anything as far as drugs, right?
Right.
So what would be a roundabout way to become a patient of yours as a first responder? You know, you go to your employee and say, well, I need a week off to get these infusions to help me. Well, what are you getting infusions for? Well, you know, I've got some anxiety and depression and possibly some PTSD, and they're going to treat it with ketamine. So now you have 2 red flags.
Right.
Well, he can't do the job because of the PTSD, and he's going to go take ketamine. You know, so as a first responder, what avenue could I take to make that okay?
Mm-hmm.
That's an excellent question.
We struggle with it.
I'm struggling big time because y'all are the people that we want to help the most. Because we know I have a friend that's a firefighter, and you know, we first started, I was asking him what percentage of firemen, you know, have PTSD, and he just kind of chuckled and he said, off the record, 100%, to some varying degree, 100%. He's like, you don't see what we see and not. And I completely get it. But you can't admit it. So how do you do it? We can treat symptoms. Talking to some ketamine clinic owners that are having some luck getting in with first responders, we can treat symptoms like anxiety with ketamine. And I don't think that knocks you off. I could be wrong. And it's really a conversation that we are wanting to have with fire departments, with chiefs, and to figure out a way, hey, how can we do this and make it okay for your guys to come and seek treatment? Because it's going to make y'all better. Your home lives are going to be better. Your mental health is going to be better, and that's going to make you better on the job. And there's no reason for y'all to be left out on this island dealing with it yourselves when there's something that works in 70 to 80% of the cases. Mm-hmm. So it's a conversation that I would be more than happy and willing to have and want to have with your superiors and whoever makes those rules, to try and figure out, how do we go about this? What do we need to do?
Yeah, I need to hook them up with Doc.
Yeah, that would be huge.
Yeah,
we've struggled with finding the right person to sort of breach into that system, because it's very tough. And we've had people in our office here, you know, sort of pitching ideas on how we could work around it in some way. I mean, you shouldn't, I really don't know how fire department, all that works, but from a medical perspective, you really shouldn't have to tell anybody why you need the time off.
Sure.
But the thing is, we're not billing insurance, so there's not going to be an insurance record that you were here, and we're not going to give you records out unless you give us explicit permission to give your records out. So
I guess my actual question was, and I'm sorry for not forming it correctly, but so I do take off. Let's say I take off for the 2 weeks to get y'all's infusions. I come back to work and I back a fire truck or an ambulance into a mailbox.
They take drug tests all the time.
I'm going to be drug tested right then. So
can y'all have surgery?
Yeah.
Mm-hmm.
Yeah.
Ketamine in the OR. What happens if you have back a truck into it a day or two after your surgery?
Okay. So how long does it stay in your system?
Ketamine itself, the actual drug we're giving is metabolized very quickly, but the metabolite that does most of the work is called norketamine. That's what it turns into once it's sort of filtered, and that can last days.
Mm. Yeah, that would be something to discuss with.
It just pisses me off that
Because my thing is, if you can have surgery and you can go back to work in a day or two, if it was a minor surgery, and those same metabolites are in your system, if you had something like that happen and it came up and you said, hey, look, I had this ketamine infusion, we could obviously vouch that yes, patient did get this, this medication, so that would make sense for them to show up. Unless we're not going to release why you had that medication.
Right.
We don't have to release why you had that medication, but we can say that it was prescribed to you as a physician. It was infused under our supervision, and you would have been well off of the effects of the medication by the time you were back at the job. Yeah, obviously, if you have the ketamine infusion, you can't drive the same day, you can't do your job the same day, but after that day, you can go back, and that's standard for any kind of surgery or procedure.
Yeah, the norketamine metabolite won't give you the symptoms that the ketamine that we're giving will. So even though you would pop positive because the metabolite is still in your system, you should be having no ill effects from that metabolite being in your system, because it's really just the day of that you would be considered a quote unquote DUI if you were stopped by a cop and whatever. So there's really no reason a few days out from your infusion, even if you did back a truck up into a wall, that the ketamine should be the culprit. But everything Brandon says is correct. That, I think proving that, hey, you didn't just take this at home and start driving around a fire truck, that this was something prescribed, that was prescribed by a physician and given under monitored circumstances.
Yeah, controlled system.
It should be. This is one of those things where if we can get connected with somebody that can understand, like, hey, this is the process, this is legitimate. It would really help. I've got my best friend in Memphis is Memphis Police, and when we first opened this thing, it was, man, he's like, if you can get first responders in there, he's like, that's the dream. He's like, same thing that guy told Brandon. 100% of these guys got PTSD. He's like, but they won't talk about it. They can't talk about it, or they're going to be taken off the job. So he's like, if you can get guys into your clinic, get them treated, and get them back on the force working optimally, he's like, man, that'd be fantastic. So
yeah, I think the way to break that barrier is just to, like you guys said, talk to the higher ups with the different companies, and because once the company or the government people approve it, then these guys could go and not necessarily have to tell anyone why they're going, but they know that if they pop positive on a drug test or something, that it's okay and it's approved. It's the not knowing and like, will I lose my pension? Yeah. Will I lose my job kind of thing?
Totally understand.
And that's our biggest hurdle in opening this clinic is we're having to educate the public and providers on ketamine. Usually you open up a ketamine clinic and you get one of three responses. One is like you, where your people are like, they have no idea what ketamine is. The second isn't that a big cat tranquilizer, because veterinarians use it for anesthetics. And the third one is they just kind of look at you funny with a smirk, and they used to party because they took ketamine orally in the clubs or whatnot. And so it's got that kind of stigma to it. And it's educating the people that need to be educated, and having that conversation, because it is such a just safe medication. It's a relatively benign medication, and the effects, the effects that people are concerned about are so short-lived. It's not something that's going to be affecting people when they get back to the job. It's more benign than most of the oral medications that we take. It has less of an effect than those. So it's talking to the right people and just educating them. But it's hard to get to the right people.
Would y'all suggest talking to the chiefs of each station, or is there somebody higher than that would be
the chief of the department?
Well, yeah, I mean, that would be a good jump off point. But the chief of the department has bosses also who, the county commissions or the people who deal with the insurance and drug testing and HR. But I think for sure getting in with chiefs would be a huge jumping point, big time.
Okay.
Medical directors would be big. And I think that if you guys came with the evidence that it seems like you guys have, as well as the licensed psychiatrists or people in that field could also provide some sort of documentation saying, look,
Like
we've treated these patients for years, and these antidepressants or anti-anxiety medications, they've made a little bit of a difference, but nothing like what this has done.
Yeah.
I think that most would be very receptive. I mean, you have to think, you're only as good as your employees, right? So if their employees are functioning at 99% and their attitudes are great, why wouldn't anybody want that? I think it's just the headache that it may cause. This sounds like a no-brainer, and some of the research I have done, and like you've mentioned earlier, was this is almost instant, right? So you have to take your antidepressants for weeks or months.
Sure.
And another big thing, I struggled with anxiety, and not so much depression, but big time anxiety a couple years ago. And I was totally against antidepressants. In my head, I couldn't comprehend taking something for anxiety and depression that can cause anxiety and depression and suicidal ideations, right?
Yeah.
So I think, going back to your question, I think you starting with chiefs and medical directors would be huge.
Okay.
I think, like you said, it's just education. You'd have to just educate people and, make people realize this is a legit form of treatment and that it does work and it is long-term and it's, less harmful than, honestly, the treatments that are out there and approved. It's just education, I think.
Yeah, I agree.
Yeah. I mean, I always come back to like, hell, WHO would not have it on its list of 100 essential medicines of the world if it wasn't exceptionally safe medicine. And
that's what our medical director is a firm believer in, man. She says that this is one of the safest medications that we can give. It's not a respiratory depressant. You're not going to bottom somebody's pressure out. In fact, if I'm not mistaken, it has the opposite effect, right? It can boost pressure.
Yeah, there's times we have to, break the beta blockers out to bring blood pressure down.
Drop them down.
That being said, there are certain areas where it shouldn't be given. People with really bad eye problems, it'll increase your intracranial pressure, intraocular pressures, things like that.
Have they proven that?
Really?
The ICP, have they proven that?
No.
Wasn't that a big debate?
Yeah, there's a big debate, and it's kind of starting to go the other way. There was a paper written about a closed head injury on a mountain climber that fell and hit their head, and basically they were going to have to get them out of there, and helicopters can't fly up there, this, that, and the other, and the only choice they had was ketamine. They couldn't intubate them at the time, so that the only choice they had to get them out of there and sedate them was ketamine, and they did it, and the patient did great. And it's I was taught you don't give ketamine in ICP or questionable ICP.
Same here.
I mean, you know the same thing, being on the trucks, with car accidents and things like that. But that's kind of one of those old beliefs that's being challenged right now.
Kind of like you don't give pain medicines to abdominal pain. That's out the window now, big time.
Yeah.
No, that we early on when we were giving ketamine in the field, we would take them to the hospitals, for bad car wrecks or anything that had head trauma. And if you gave ketamine, you'd almost get the stink eye. This guy has no idea what he's doing. He gave ketamine to a head injury. And I don't know. I was legit asking. Because there's just so many studies, right? It's just so hard to keep up with.
Sure.
But I have seen both sides of the coin. Some people say that it's not going to hurt anybody with ICP, and some say you absolutely don't give it because it can raise ICP. So I know it causes the nystagmus, right? For penetrating eye injuries, you wouldn't give it, and the laryngospasm, right? It can
it can make
somebody
you
down.
Right. Those are hyperactive.
But it wouldn't do that in the doses you guys are giving, correct? The lower micro doses.
I've seen nystagmus. Yeah.
Okay, but not the laryngospasm or lockdown or anything like that.
No, shouldn't.
No, it shouldn't. Hopefully not. But that's one thing about Wesley and I is we're trained to
fully prepared for every scenario.
take care of that if it happens.
Sure, you prefer not to, obviously, right?
Yeah. Happens quite a bit in the OR where you have laryngospasms and people don't realize it, but it's dealt with, and as long as you're experienced with it, it's not a problem.
Another reason why you need to research who's giving you the treatment.
Yeah, absolutely.
Yeah, right.
Yeah,
exactly.
that's one thing we've run into, and obviously this is all anecdotal. We don't know, but we've had patients come in saying, we came from another center, and they're giving us ketamine treatments in the PACU bay with just a curtain, and you can hear what everybody's saying, and there's no getting up to go to the restroom. You either get a catheter or you have to sit on a bedpan. It's just a terrible patient experience. Or, we've had patients come in saying, well, I came from this other center and they don't use any monitors, which is appalling to us. And like I said, we don't know whether that's true or not, but that's what they say. Mm-hmm. So it's, knowing, hey, does this place have laryngoscopes? Does it have ET tubes? Does it have an emergency cart with ACLS medications in case something happens? You don't know unless you ask the question. So
yeah,
absolutely.
That's a good segue. Okay, so I'm a patient and you're about to give me an infusion. Take us through.
I feel like I'm in a mega code situation here.
Right. Yeah.
Take us through the process. Like what would I experience as a patient?
Oh, that's extremely tough to say. Every patient has a different experience, and each individual infusion could be a different experience for them. I always say it depends on the headspace that you come in with. It's very important that you prep your brain before you come in, whether it's the day before, not watching violent TV or listening to really terrible music. And by terrible music, I mean like talking about death and stuff. I mean, we've got one patient right now, like his thing is death metal. Like that's his soothing, whatever, this, just that's all you can hear. And he listens to it while he's having infusions. And they would totally put me in a bad headspace, but to him, he's just soothingly just laying there and just enjoying a lot of people say they have some sort of godlike experience, whether they see God, or some have said that we had one guy say he saw the universe below him and he could like dip his toe into it. And other people, especially with PTSD clients, they'll relive an experience that caused the PTSD. But the cathartic thing is seeing it from a different perspective. So one guy remembers as a kid having a really, really bad asthma attack. And he came from a religious family. And he was there floating over his bed, seeing himself on the bed with one parent on each side of him praying over him, thinking that he was about to die. And it was sort of this near-death experience. But coming out of it, he had a really positive response to it because he got to see it from a different angle.
Wow.
That's something that he went through as a kid, where he almost died, and so he kind of relived it from, like Wesley said, an outside experience. It's everybody is kind of different there as far as the experience they have. That dissociation is therapeutic. As far as outside of just the experience on the ketamine, the experience coming into the clinic, we have individual rooms. Everyone gets an individual room for ketamine treatment. We have extremely comfortable.
We opted for very
leather reclining chairs.
Nice.
Like I'm sitting in one right now. But reclining chairs, so it's leather theater chairs, very comfortable. We start an IV. It's relatively small gauge IV, so it's not too painful. Blood pressure, EKG, oxygen monitoring, everything, the standard monitors that we use in the ORs. And once we get the baseline vital signs and start the IV, we start the ketamine treatment. And then, 40 minutes as far as mood disorder, 4 hours later, we're monitoring vital signs, we're monitoring the patients. If someone does have some sort of an anxious experience on the ketamine, Wesley and I have dealt with it for years in the ORs. You can talk people through it. You're dissociated, but you can talk to the patient. So I can carry on a conversation, kind of center you where you are, remind you, you're having the ketamine treatments and whatnot, and you can center somebody. That's not the most common thing that we'd have to do. It's usually people usually tend to have a pleasurable experience, as long as, like Wesley said, get your mind in the right place before. The music choice is very important. I'm a big believer in having nice music, preferably without words, but whether it be like spa music or classic music or jazz.
Do you like give them headphones to listen to?
Right now, we're asking people to bring on their own headphones.
Mm-hmm.
Thanks a lot.
Yeah. But we do have headphones normally
Okay.
for people to listen to. We have a Bluetooth speaker that we can, throw in the room if they don't have headphones or whatnot, and turn that on. And
some people don't want to listen to music.
Yeah, some people just don't. Yeah, and they have great experiences too. So.
Yeah, I mean, one infusion, somebody might have a really positive experience, and then the next infusion, they might feel a really anxious, sort of negative experience. And we always come back to the patients that it stinks when you have a negative experience, but obviously your brain wanted you to go there at that time. Mm-hmm. But research shows no matter whether you have a positive or a negative disassociation, it's the disassociation that's doing the work.
That's what I was going to ask. You're still having the same outcome, whether a positive or negative experience.
Correct. And really one of the great things that we started doing was, getting contracted with this therapy practice in Atlanta, where we opened our second location, doing ketamine-assisted psychotherapy. That's the patients that have done it so far, it's been a game changer. So doing therapy directly after, while you're still under the effects of ketamine. Our therapist that we use a lot is really good. He'll meet with patients before the infusion to sort of center them and sort of get a gauge of where they want to go. And he can kind of get them in a space where maybe that's what they experience. And then he meets for them for an hour afterward. And you can kind of unpack all this stuff immediately. And the ketamine, the way I like to say it is it opens, it's not a cure for depression or anxiety or PTSD. It's a massive tool in your toolbox. So it can open up all these doors. And some patients have said it's like emotion that they've been keeping deep down, they haven't been able to access. And once that floodgate is opened, I mean, a lot of people cry after their ketamine infusions or during, and it's just this flood of emotion. And then to have somebody afterwards that's trained to do that, talk you through and sort of unpack what you experience, that's where people have breakthroughs versus just sort of doing ketamine and then maybe a couple of days later having, it's still really helpful. And we prefer patients to be working in concert with a therapist or their therapist versus not having any at all. But definitely we've seen extremely good benefits from the ketamine assisted psychotherapy.
That's amazing.
Alex would be very happy that I plugged him there.
But yeah, and even at our Woodstock location, we have an extra chair in the room with the patients. That's usually for a visitor, whoever brings the patients. That they're welcome to have somebody sit in with them if that's the way they feel more comfortable. And we've also told, look, patients and therapists, if you want to do the ketamine assisted psychotherapy and you want to come in and have a therapist in the room with you, then that's open to them as well. Their therapist is more than welcome to come in and sit down with them and do the same.
Yep.
That's awesome. Do you have any?
I'm just wrapping my head around what you guys do.
I know. I feel like it's been 20 minutes. Y'all have had me like engaged.
I've really been like
I know.
tuned into this. It's great. And it's
stop by and see us.
Well, I was going to ask.
We'd love to.
I would love to meet you guys and
Oh, fantastic.
Come check it out. Maybe drop an application for a paramedic. Start IVs for you guys.
Yeah.
No, thank you for your time.
Thanks for having us.
Informative.
Yeah,
awesome.
If we can help you guys in any way, please let us know. Well, we totally back what you guys are doing. Like Molly said, we are all for alternative medications and in helping first responders and anybody. So if we can help you guys, please let us know.
Well,
I think getting us any of those chiefs' names that would be good for us to talk to. We're willing to call or email anybody to extend this further. We're having the same deal with trying to get in with the veterans groups. We're trying to get partnered with TRICARE so we can actually become a community care partner so vets can come and get treatment, because the VA doesn't have enough resources to give this to these patients.
That's amazing.
But the hoops,
Mm-hmm.
we can't find the right person to talk to. It's just, I mean, the number of people you have to go, it's infuriating, really. I have a lot of military in my family, and that's a big population that I want to get in here. But, you know, until we can get in with them, it's going to be tough.
I think it's like anything else. I mean, once you get the ball rolling, it'll hopefully.
Everybody's told us that. It's finding that one good advocate that really understands, really wants to understand what you're doing. The problem we're having with the VA is they want to classify us as an infusion center, which essentially we are, but they see it as this sort of like, you know, place where you go get chemo or IV or antibiotics or whatever. And they're like, we already have too many of those in the Atlanta area. It's like, well, we're one of very few ketamine clinics in the Atlanta area. So I don't think you're oversaturated, and trying to get somebody to understand that we're completely different. And it's just, we'll work through it.
We're happy to help, and we love what you guys are doing.
Thanks. Anything
really
you can do with the fire department would be fantastic.
But Brandon, I'll get with you this week. Again, thank you guys very much for your time. We really appreciate it. We enjoyed it.
Thanks for having a word.
Thank you so much.
Yeah,
always willing to spread the word.
For sure.
Absolutely.
We appreciate it.
Get past the stigma.
Absolutely, man. Absolutely. Well, you guys enjoy your weekend. And like I said, I'd love to do a follow-up with you guys sometime soon.
Absolutely.
Fantastic.
Thank you very much.
Have
Thanks
a great
so
week.
much, y'all.
Thank y'all.
Bye, guys.
Okay, thanks.
All right, bye.